Welcome, welcome, welcome. Welcome to the once again to the voice live with Sandy. I missed you guys and I hope that you miss me too. So put in the comments what you've been up to lately. I myself have been so busy in the past few weeks, it's not funny. Anyway, I want to thank you all you beautiful people out there for joining me this evening from wherever you are. Today we're going to be talking about heart truth. Heart health and survivors of domestic violence and abuse. Looking at the heart health in the context of survivors of abuse and domestic violence. It would be easy to suggest that increased stress levels from experiences and reactions to violence and abuse can elevate blood pressure and impact our heart health. A lot of people did not know that our health is actually affected by a lot of things that we had experienced in our lives. But what is remarkable is how strong this link could really be. As per recent research, while there's a strong need for more comprehensive research, recent surveys with large sample size data have shown that undeniable linkage between domestic violence and increased risk of death by heart disease. And when I found out this, I was like, I almost fell off my chair, because all of the troubles that we've experienced in our lives and my parents are experiencing, I look back at it and it made me think of all the things that, like all the stress my mom went through, and then all the health issues that she's experiencing right now. It's just all related to traumas and stress that we have experienced in our lives. So in February of 2020, the results of a study released from the University of Warwick in England confirmed that domestic violence raised the risk of deaths by 44% among survivors of abuse, compared to the general population surveyed. And another study showed, and this one is 2013 PubMed and Web of Science reviewed articles that showed a clear relation between violence exposure experienced in early childhood or adulthood and cardiovascular outcomes. But what is also worth noting is the risk of heart disease is amplified in survivors of domestic violence as a result of extreme stress caused by violence and abuse in their interpersonal relationships, as well as their ability to prioritize their health over having to take care of safety and of children and survival needs. So for the most part, we ignore our health and we take care of all the things that are immediate, the things that are pressing at the moment, and then we may also avoid seeking medical care to hide unexplained injuries. I've done that. Or struggling with regular medical care or self-care resources due to inhibiting factors like depression, lack of transportation. A lot of women in our culture, they still don't drive, right? So lack of transportation can mean that they're not going to go to the doctor. And in some cases, and especially in the United States, it also health insurance. We're lucky in Canada that we do have health insurance, but many in the United States and other countries, I'm not sure, don't have health insurance. So that's one of the inhibiting factors that would stop women from seeking like health related issues, seeking help for that. The other thing is there's when I was doing my research, I found that immigrants and refugees survivors with language access barriers or who are financially dependent on their abuser also are at risk for the above mentioned reasons, as well as limited multilingual resources for heart health awareness. And there is not a lot of heart health awareness in relation to domestic violence. So let's share the love in the form of heart health awareness for survivors of domestic violence and abuse. That's what we're doing here today. We're sharing that awareness and letting people know that it's related. Because strong hearts also mean regular medical care and self-care. And we talked about self-care so many times on the Voice Live with Sandy. Domestic violence is a healthcare problem of epidemic proportions. And trauma caused by abuse, domestic violence, contributes to a number of chronic health problems. And that includes high blood pressure, diabetes, depression, hypertension. My cat is trying to get in the door. Hypertension, alcohol, and substance abuse. Also sexually transmitted disease such as HIV and AIDS. And also what really shocked me was the big C word. Yes, cancer. It also does affect us in the form of cancer. Domestic violence limits the ability of women to manage their other health issues. And I know that. I've been there. I've done that. I ignored my health for so many years, focusing on surviving for me and for my children. And despite these facts, there is still a critical gap remains in the delivery of health care to battered women. And in my time, I didn't have that at all. I did not have that at all. So, you know, like despite all these things, it's not reported. It's not reported in our reports, on our doctors' reports. So the delivery of healthcare to battered women, with many providers discharging a woman with only the presenting injuries that are being treated, leaving the underlying issues or the underlying cause of the injuries not addressed. My own doctor did that. My own doctor did that because he was also my ex-husband's doctor, and they ignored the online issues until I finally addressed them with him. So domestic violence is virtually impossible to measure with absolute precision due to the numerous complications, including social stigma that inhibits victims from disclosing their abuse and verifying definitions of abuse, because the verifying definitions of abuse used from study to study, it varies. So the estimate range from 691,000 to 691,000 incidents of violence against a current or a former spouse, boyfriend, girlfriend, or to 3 million of women who are being physically abused by their husband or their boyfriend per year. And about 85% of victimizations by intimate partners are against women, and 15% victimization is against men. Yes, men do get abused as well. But the sad thing is, only 1/3 of the women report being physically or sexually abused by a husband or boyfriend at some point in their lives. And, and less than that are reported of childhood abuse. And again, I know that never got reported, never got spoken about, never got told. So childhood abuse also relates to health issues in the long run. And most of us who had been through all of that can relate. This will resonate with you like it did with me. And I feel your pain. I've lived through this. And I'm going through all this health-wise. I'm finding out so many things about my health that I did not know before. And as we get older, it surfaces. So did you know that the recent survey shows that 31% of our population say they know a woman who had been physically abused by her husband or her boyfriend in the past year? And still, we don't do anything about it. We don't bring that awareness, and we don't talk about it. We sweep it under the carpet and we let it go. Let's not do that. Let's talk about it. Let's bring awareness to this. So the survey that I was looking at concluded that early identification and treatment of victims and potential victims will most likely benefit the healthcare system as well in the long run. Because emerging research indicates that hospital-based domestic violence intervention will reduce healthcare costs by at least 20%. And in addition to injuries sustained during violent episodes, physical and psychological abuse are linked to a number of adverse physical health effects, including arthritis, chronic neck or back pain. We know that back pain is there all the time. Migraine. I had suffered so much from migraine when I was being abused, and I didn't even know that it was related to that. I had no clue. I just thought I have migraine. Yeah. Never thought it was included. It was, part of my abuse. And other frequent headaches also the research shows stammering, problems seeing, sexually transmitted infections, chronic pelvic pain, and stomach ulcers. In 2019, there was a Canadian study found that women who experienced domestic violence had above average risk factors for heart disease. But unfortunately, comprehensive research on this topic is very sparse. And I tried Googling it. I can't find that much information on it. I did find a few studies, and a new study looked at some data from about 18,547 women over the age of 18 who had experienced domestic abuse, and compared them to 72,231 women of a similar age who had lifestyle risk factors for cardiovascular disease. That was, there is not a lot of research. So still we are trying to bring awareness because there's not a lot of research on this. But researchers did look to see which women develop diabetes, high blood pressure, and various types of cardiovascular disease, including coronary artery disease, stroke, heart failure, and peripheral vascular disease. The study found that women exposed to domestic violence were 31% more to develop these cardiovascular disease than women who hadn't experienced abuse at all, with a particularly strong link between abuse and development of coronary artery disease and stroke. And if we look at people that we know who have experienced stroke or had heart issues, look at their lives, look and see what kind of stress they've been through in their lives, and try to relate to it and see if you can, bring awareness to this. So in addition to the study showed the women who experienced these domestic violence abuse, there was 51% that were more likely to develop type 2 diabetes compared to the unexposed group. And the researchers didn't find any significant difference in the development of high blood pressure between the two groups. So high blood pressure might not be as strong in the two groups at all. There was a research done by a doctor named Dr. 𝗷𝗰𝘃𝗲𝗓. I hope I'm saying his name right. He led a study that wasn't able to answer exactly why the association exists between domestic violence and heart disease, but he does believe that is likely due to the effect of acute and chronic stress. And this can lead to changes in the inflammatory system, which may predispose you to cardiovascular disease as well as diabetes. Additionally, people who are exposed to domestic abuse may be associated with other lifestyle factors, such as poor diet. And, we know that when you're being abused, you don't eat as much. You're not hungry. You have too many other things to worry about. So yes, so poor diet, alcohol, smoking, as well as mental health and other contributing factors to the development of cardiometabolic disease. So doctors and public health officials need to improve how they detect and prevent domestic violence and minimize these risks, like cardiovascular risk, domestic violence. So domestic violence is poorly recorded in our healthcare system, whereas recording may be better in the police records. But how do you get that? How does the doctor know? It doesn't. it doesn't relate with the other. So the doctor wouldn't ask you for your police records, or the police wouldn't ask you for your doctor's records. So Dr. Chan then emphasized that the need to improve the way public sectors communicate with one another so that the doctors can be more aware of these domestic violence cases and be able to provide medical and psychological support for their at-risk patients. He also encouraged that general practitioners and other health professionals use simple questionnaires to help identify patients at risk. I wish I had this when I was seeing my doctor. One protocol that he recommended is known as AVDR, the acronym for asking, validating, documenting, and referring. So that's AVDR. So if anybody's a doctor or a practicing nurse, AVDR, acronym for asking, validating, documenting, and referring. The first element in asking a question along the lines of, I see patients in my practice who are being hurt or who are being treated by, being mistreated by someone they love. Does this happen to you? The validation side is saying, this is not your fault. Then the healthcare professionals must remember to document it and make a referral at the end. This is so important, and I wish that the healthcare providers can be more aware of this. I think I'm going to mention this to my doctor as well. So Dr. Chandon said that it is important to remember not every woman experiencing domestic violence will go on to have long-term illness. And our understanding of the physical and mental health effects of domestic violence and abuse is argumentatively still in its infancy. That's just, it's just BS. Like, come on. We all know that it exists and we don't talk about it. That's why we're bringing awareness so we can talk about it. That's why we have The Voice, Life with Sandy. So an important limitation that may affect the results in domestic abuse is severely recorded in the healthcare records. So violence against women is an important issue that has primarily resonated in mental health literature. And we need more studies like this one that will look into these medical side effects. So why did I decide to talk about heart health today? Let me tell you why. As you all know, I have recently graduated as a health and life coach. And part of my program, it included further studies on health. It was a mandatory further studies, but I actually went on to do it. And it was just phenomenal, the things that I learned after even being certified as a health and life coach. So as I was listening to Dr. 𝗵𝗪𝘃𝗲 on his discussions on heart health, he referred to the side effects of domestic violence and abuse on the heart and the health. And it hit me like a ton of bricks. I had to went back and listened to it again because I was experiencing some of those same effects in my life right now. And he says that these effects does not happen right away. It takes years to surface, like high blood pressure, diabetes, hypothyroidism, celiac disease, and the list goes on. And it just hit me so hard. Like I was just blown away by the fact that all these things that I'm experiencing, it must have had to do with all the abuse that I've experienced in my life, the childhood abuse, the sexual abuse, the domestic violence in my marriage. It all contributes to my health now. So what can we do to help our health after abuse? Let me read some of the things that Dr. 𝗵𝗪𝘃𝗲's protocol says. I have to pull it up. I hope I can get it out. I have so many screens open. Protocol, here we go. He says to focus on your food, to increase your fiber intake to about 10 servings a day. And it can take you up to a month to gradually work into this level. Examples of fiber servings would look like a cup of fruit or vegetables, an ounce of nuts or seeds or beans, dark chocolate, You may add some, fibrous foods like nuts, seeds, beans, green leafy vegetables. And these are things, if you're interested, we can talk about. So the step one is focusing on your food and lowering your stress. High stress levels can be associated with heart disease. We all know that. As you may move through this protocol, you will deepen your ability to handle different stress factors. And, do 10 minutes of peace and quiet a day. Set a timer so that you can allow your brain and your body to relax fully, trusting that the timer will go off and allow you to resume your daily activities again. I've been doing this even at work. I would take that 10 minutes just for peace and calm. No phone, no nothing, just clear your head. Step two is to define your fiber. Not all fiber is created equally. And the popular sources of fiber includes bread, cereal, crackers, the high glycemic load, which we think are occasional treats, not staples. Begin to add the right kind of nutrient-dense food. The best choices are leafy green vegetables and nuts, and like I said, a cup of cooked beans. And those are the recommended ways of defining your fiber. And then you track your movement. Build awareness of how much time you move per day. Get one of these or like a Fitbit or something, and you'll find that to measure your daily number of steps, such as a fitness tracker, you may be shocked to see how little you move. And you think that you're moving, you may experience on a daily basis that you may be, you may not be moving as much as you think you do. And my goal is like 10,000 steps I try to do per day, but I don't always meet that, not when I'm working. But when the better weather comes on, I definitely do walk about 6.5 kilometers on a daily basis. So step three is choose heart healthy fats. And that's like, almonds, use virgin olive oil, use avocado oil, and other great sources that are like wild caught salmon and coconut products. And if you're from back home like me, anything with coconut I love. So that's not an easy one for me. So yeah, choose healthy fats and deepen your self-care. Take your stress management to the next level by beginning to incorporate self-care practices consistently. Dr. Masley said that, it would be nice to take a hot bath with Epsom salts and lavender essential oils by candlelight. 10 minutes massage by a loved one is a great technique as well to deepen your self-care. Watching the sunset, reading a book, anything that's your favorite thing to do to help you relax, do it. Step four is boost your exercise routine. So if you are walking for 20 minutes, try to do it 30 minutes, or try to do 30 minutes of aerobic activities in your daily routine. Taking a brisk walk in a neighborhood, and cleaning the house actually is part of building up that aerobic activity. I did that today. And increasing your fitness level by, letting your body handle different stressors, and it will tell on your sleep, your digestion, your memory, and increase your confidence. Step four, part two is to check your intake on your fiber again. As you do these steps every day, check your intake on your fiber and how much you're consuming on bread and such things. And then up your self-care. So if you were doing the 10 minutes peace and calm, and then you're doing your baths, and try to do a little bit more than that so that you're getting better sleep, and challenge yourself to get a good night's sleep. Reducing your caffeine or your alcohol intake will help you to sleep better. And also increasing your daily activity does help you to sleep better. Step five, start to eat cleaner food. And what does that mean by cleaner food? Not washing the food. Start to purchase food that are more naturally organic, that are, that has antibiotic-free ingredients in it, and animal proteins that are, select wild grass-fed or pasture-raised meats. And I know that it's expensive, especially here in Canada, but it is very much better for your health. And then part of step 5 is to evaluate your fitness again, of doing that 20 to 30 aerobic exercise, hitting your 10,000 steps a day. And I know that the better is getting better. I'm sure we can all do that. So step 6 is assess your vitamin intake, because vitamins are very important for our digestion as well, and our heart health. So ask your health provider what the best vitamins are, like vitamin D supplements, multivitamins, vitamin B, folic acids, vitamin K, which you can easily get by consuming 1 cup of green vegetables. Yeah, you can do that. So but be careful, because if you're taking anticoagulant medication, check with your doctor first before doing this step of your vitamin intake. Step 7 is add more herbs and spices to your meals. Well, I don't think we have to tell West Indians to do that, like pepper and fresh herbs and ginger and garlic and dry herbs and oregano, parsley, curry, chili paste. We do that already. So step 7, we've got that one. And then part of step 7 is to meditate. Meditate has been significantly proven to provide a host of benefits. You can do it anytime. Set aside some time in the morning or the evening to sit quietly. And third, inward. Begin with 10 minutes of meditation, and then see if you can do up to about 20 minutes a day. So 10 minutes is enough to start, and then experience that positivity, and then try to do it like every day. But twice is highly recommended, twice a day actually. So then step 8 was to prioritize clean, non-toxic food. And one of the things that in our coaching sessions that we have learned is to declutter your pantry and get rid of all the junk that you have in there, and all the toxic foods and all the fatty foods, and try to get a clean pantry so that if it's not there, you won't eat it. Try to eat a lot more fruits and vegetables, and dried the organic foods as well. Diversity in your workout is a great thing too. So mix aerobic with strength training and stretching, such as yoga. So your heart health works, you have a heart health regimen. And for your optimal weekly workout routine, strive to do some kind of 2 intense interval sessions, like 2 moderate activities with 2 strength training activities, 1 yoga or 2 Pilates sessions. So try to mix it up so you don't get bored, and it also helps your well-being as well. Step 9 is to recheck your levels. So you're going to go back and check everything that we talked about from step 1 to step 8. Now, if you guys want these steps, please inbox me and I will send this to you so that you can, work on this. And I think that step 9 was, that was the last one. So try working on that and see how you feel. Let me know, please. I really would like to get your feedback on this, if you've tried any of the steps. And like I said, if you need the written steps, I can send it to you, or maybe I'll post it down at the bottom afterwards. So anyway, so that's it for today. And thank you so much for being here today. Let's continue to be aware of heart health and the effects of domestic violence and abuse on our health. And I want to let you know that I will be away for the next 2 weeks. For next week, I'm attending a coaching seminar. I'm so excited about that. And upon returning, I'll be preparing for Mother's Day show on May 7th at the Devi Mandir, as well as our Dancers Unite fundraiser. We are organizing a fundraiser with all the proceeds going to the Canada-Ukraine Foundation, and we are so excited about that as well. And we are looking for donations and sponsorships. So if you're interested, please inbox me. The fundraiser for that is on May 29th. So The Voice Life with Sandy will return at a new day and time. Yeah, keep that in mind. New day and time. So due to the summer seasons, we'll be doing the voice on Wednesdays at 7 p.m. instead, so that everyone can enjoy their weekends and go away. I go away on weekends as well, so that you can still join me for live with Sandy. Please join us for the next one on Wednesday, May 11th. Have a wonderful weekend, everyone. And I will check I will respond to all your comments after I close off. So thank you so much. Have a great evening and a wonderful weekend. Bye.